Can babies have chiropractic care? Absolutely, babies can have chiropractic care, and I highly recommend that you do get your baby checked, specifically if they've had a very traumatic birth, but even if they've had a very normal birth. The reason why we recommend care or checks for newborns is because they can't actually communicate to us that things aren't really working well for them. So we are specifically trained to be able to find these different things in the baby's body that aren't working 100% and help them work through it so that they can have a more comfortable experience as a new human to this world. So I see children all the way from birth up until in their teenage years, and the benefit is really so that we can start growing healthy children and start fixing our broken adults. A big misconception is that because they're young and small that they are very resilient and they will bounce back, which is actually really true. They are very resilient and will bounce back, but just like us as adults, they store a lot of their stress in their spine and in other portions of their body. And because they're so resilient, their body will just keep pushing forward and keep going, and they may not even really be able to communicate to you that they're feeling kind of not 100% themselves. So getting kids checked from a young age, we're able to kind of find these little things before they're even communicating them to you, and so that we can make sure that they're growing in a more healthy way. I think parents are a little bit worried about how we're going to be adjusting babies and adjusting children, and really there's a very different way to how we adjust adults versus a baby. So with babies, it's a very, very gentle adjustment. It's what we call touch and hold. So if you took your finger and you placed it just on your eyelid like this, just enough pressure so that you couldn't open your eye, that's the pressure that we would use to adjust a baby. If we did need a little bit of extra on the baby, we usually use an activator, which is just a small device which puts a little force through the specific joint that we need. So the spine is really the most important part of your body because it's the bridge that's protecting your spinal cord, and so that is the bridge that connects your brain to the rest of your body. And so for a baby, they're living their whole lives through the lower portion of their brains, which is telling them to eat, sleep, poop, and cry pretty much. And so when that portion of their brain gets extra pressure because things aren't quite working quite right in their spine, that can cause a lot of different issues for them that can show up to parents as colic, inability to feed, excessive crying, excess spilling. If you're noticing anything in any of those functions for your baby, it's definitely a good trigger to let you know that they should be getting their spine checked.